This demonstration will show you how to insert an IV catheter using Bbraun's Introcan Safety IV catheter.
Hi, Tom.
Greet your patient and explain the procedure. Whenever possible, explain the purpose of the infusion and the steps of the procedure.
I need to put a tourniquet on your arm and see what kind of veins you have.
Inspect the patient's hand and arm, looking for a vein that is clearly visible, can be palpated, and has a straight section for entry.
You're looking for a vein that is nice and straight, is palpable, it's not firm or sclerotic. I think I'm going to go ahead and start a catheter in your hand so that if a nurse later on wants to continue the therapy, she can work her way up your arm.
Fine.
I'm going to take the tourniquet off, give you a little bit of a rest while I go wash my hands.
Wash your hands. Don clean, disposable gloves. Apply a tourniquet approximately 3 inches above the intended venipuncture site and have the patient pump his fist to distend the veins.
Hey, Tom, I have to wear gloves for this procedure.
Vigorously cleanse the area with an alcohol swab, followed by an antimicrobial solution, or as your agency's policy dictates.
And I'm just going to prep the intended insertion site, first with some alcohol, beginning at the intended insertion site, working outward in a circular motion. And I'm going to allow that to air dry. Are you allergic to iodine?
No.
Okay, then I'm going to prep the site with some betadine solution, which does contain iodine, again in a circular motion, and I'm also going to let that air dry. Select the gauge size, taking into consideration the patient's vasculature and intended therapy. Okay, Tom, I'm going to put that tourniquet back on you now. I'm going to apply it about 3 inches above the intended catheter insertion site. Go ahead and pump your fist about 3 times and then relax it.
Using your non-dominant hand, retract the skin below the entry site.
Hey, Tom, you're going to feel a pinch.
This helps control the position of the vein and prevents the vein from rolling.
Going to insert the catheter or make your venipuncture at approximately a 30 to 45 degree angle.
You may feel a slight resistance and then a release as the needle enters the vein. Observe for backflow of blood, called flashback, in the clear plastic hub of the catheter, indicating that the stylet has entered the vein. Once blood is visualized in the flashback chamber, lower the angle of the catheter to approximately 10 degrees, or nearly parallel with the skin, and advance the catheter another 1/8 of an inch. This will ensure that the stylet and catheter tip have entered the vein. This insertion technique is called a direct stick.
Once you have blood flashback, you drop the angle approximately parallel with the patient's skin and advance it 1/8 of an inch. Using the push-off plate located on the top of the catheter, advance the catheter into the vein. Okay, remove your tourniquet.
While stabilizing the catheter hub with your non-dominant hand, release the tourniquet with the other hand. Blood exposure may be minimized by placing your middle fingertip firmly over the vein distal to the catheter tip, approximately 1 1/4 inches, to occlude the vein, and placing your first finger on the hub to stabilize it. This is known as the V technique. To minimize contamination of the site, you may choose to place your transparent dressing over the catheter hub prior to stylet removal. Withdraw the stylet straight back out of the hub. The stylet should be withdrawn parallel to the patient's skin to facilitate ease of removal. As the stylet is withdrawn, you may feel a slight resistance as it passes through the safety clip.
You may hear an audible click. That's the safety clip attaching and covering the stylet. Although this catheter is a safety device, it needs to be discarded immediately into the sharps container.
Remember to always discard the needle in a sharps container immediately after you remove it from the catheter hub.
You want to attach your extension set.
Connect the IV administration set to the hub while maintaining sterility.
Aspirate to verify your blood return, and then gently flush.
Initiate and regulate the flow of the IV solution according to physician's orders, promptly, to prevent the patient's blood from clotting and occluding the catheter.
Apply a dressing according to your hospital protocol.
Effective site assessment may be accomplished by maintaining maximum visibility of the catheter insertion site.
And then securely tape your extension set.
Minimize the amount of tape and/or gauze placed directly over the catheter insertion site.
The slide clamp can be maneuvered up and down the extension set, or it can be removed.
Tape the tubing in place according to agency policy. Loop and secure the tubing with tape near the catheter tubing connection to prevent pull on the catheter.
The label for the IV dressings should include the date the catheter was inserted, the time, the gauge of the catheter inserted, and the initials of the person placing the catheter. The IV tubing can be connected at this point. You also want to secure the tubing to the patient's arm and then regulate the flow according to the physician's instructions.
Remove and discard gloves. Wash your hands. Then document the procedure in the patient's record according to agency policy. We'd just like to go over some of the benefits of the Introcan safety catheter. The Introcan safety catheter from Bbraun offers a unique feature that requires no additional steps to activate the safety mechanism. A metal safety clip automatically attaches to and covers the tip of the needle as it exits the catheter hub.
With the Introcan safety passive design, the safety mechanism is automatically activated as the stylet exits the catheter hub. If you're using a non-safety catheter, the Introcan safety catheter requires no change in technique, which means that you will require minimal in-servicing. The catheter itself is also a very standard size, similar to the non-safety catheters, which means that it doesn't increase the volume in my sharps containers.
And now, in the news.
In an effort to stem the spread of hospital infections, particularly among healthcare workers, government agencies like the CDC and OSHA recently issued strongly worded safety advisories, advocating that hospitals and other healthcare organizations use safety-engineered needles and devices. While hospitals face large fines for failing to comply, patients and healthcare workers are more concerned about hepatitis and AIDS prevention. Lynn Thompson has more.
Chances are good that someone you know is a nurse, doctor, or patient and may be at risk for potentially deadly infections spread by needle stick injuries, which account for up to 85% of all accidental exposures to blood. The greatest risk from needles is contamination by hepatitis or AIDS, and liver-destroying hepatitis is much more transmissible than HIV. Now, the majority of states have already either passed or are considering legislation mandating life-saving hospital safety procedures.
We have a whole new generation of safer medical devices that are available for hospitals to provide to their healthcare workers. The challenge has been getting those devices to the front lines and into the hands of the healthcare workers that need them.
One of the most common nursing activities where safety innovations can save lives is during the startup of an IV line. Now there's a new safety-engineered device for this procedure. This new passive safety IV catheter is ergonomically designed to minimize accidental needle sticks without changing standard nursing technique. The Introcan safety catheter from Bbraun Medical has a unique mechanism that cannot be bypassed, a metal safety clip which automatically hooks on the tip of the needle as it exits the catheter hub.
It's stressful being a healthcare worker today because we have to assume that every patient we start an IV on may have hepatitis or HIV. Therefore, it's critical that we provide passive IV devices to our healthcare workers to minimize the risk of them getting stuck by a needle.
The new safety features can save all of us worry about hospital visits and the spread of infection. But most importantly, safety measures can help protect the lives of our loved ones on either side of the needle. This is Lynn Thompson.